New Disabled South presents.
Y'all's 5 ain't my 5. Because you cannot compete with me on this. So think about that and how exceptional we are as people, exceptional, resilient, all of these things.
In Virginia, over 1.7 million people rely on Medicaid, nearly a quarter of the state's population. A Virginia resident, Rachel, has learned that surviving the system requires mastering a brutal math. $60,000 infusions every 4 weeks, 18 medications, 3 paid for out of pocket, $40 in committee earnings that triggered a drop in food stamps to $18 a month. Math that doesn't simply subtract, it multiplies miseries in order to stop the poor from having any more than the bare minimum. At 23, Rachel returned home to Central Appalachia after graduate school. They were a closeted young person trying to outrun generational trauma. Within months, a numb hip became paralysis. Mystery pain became multiple sclerosis. The pursuit of independence became a 2-year wait for Medicare, navigating a system where being overweight, poor, visibly queer, and uninsured meant emergency rooms were their only option. This is a story about what happens when chronic illness becomes a full-time job, when paperwork is wielded like punishment, when surviving depends not just on care, but on being believed. Rachel learned to make new dreams, but in a state where rural hospitals continue to close and federal funding cuts threaten the social safety net, even exceptional resilience has its limits. I'm Stacey Abrams. This is Dual, the true cost of care.
Dual, the true cost of care. Full-on death drop.
Rachel's story begins with escape and return. Like many queer young people in small Appalachian towns, they ran towards cities and graduate school, chasing freedom. But chronic illness brought them back.
We didn't talk about generational trauma in the early aughts, really. But so, I think this place was like a lot of rural places. It's the fear of the unknown. The fear of difference, things you can't understand. I think like a lot of people that grew up in small rural places, I was trying to get out of here as fast as I could. Because like as a closeted kid and somebody who kind of was starting to understand their gender at that age, but just didn't have language for it and just chalked it up to being queer, it's hard. It's hard because there is no support. You don't see... you see Ellen on TV and that's great, but where are the people here?
In September, their left hip went numb. By December, they were partially paralyzed.
And I wake up one morning and I can't feel my left hip. And I'm like, that's odd. So it starts going, I'm like falling randomly. Like, what is happening? I remember one morning I got up and I walked around my bed and I just like full on death dropped. Without any intention. And I'm just kind of laying there on the floor all sprawled out. And I'm like, I think I might have broken something. And I'm like and I couldn't even move my leg out. I had to like physically pull it out. And I was like, well, that's weird. And so it was this whole journey of, in September of that year, my hip was numb. And by the second week of December, I had paralysis in 70% of my body.
It was 2010, before the Affordable Care Act. In the before times, when being uninsured in rural Virginia meant the ER was your primary care. In Lee County, where Rachel lived, the nearest hospital with a NICU was an hour away. A decade later, Lee County Regional Medical Center would close entirely, joining over 190 rural hospitals that have shuttered since 2005.
I feel like there was a combination of things that impeded my care. One, poor, fat, visibly queer, no health insurance, and going to an ER, complaining of mystery pain that nobody can really figure out in what is essentially the epicenter of the opioid epidemic. It's a lot of like colliding factors.
Even after finally seeing a neurologist and getting an MRI, paperwork errors delayed their Medicaid approval. Weeks passed, medical debt piled up. They couldn't pay student loans. They moved in with their grandmother. But Rachel was one of the lucky ones. They were housed and eventually insured. Virginia wouldn't expand Medicaid until 2019, leaving 138,000 people in the coverage gap for years.
The Medicaid was first, and then 2 years later, the Medicare came. I was just told that I had to be classified as totally and permanently disabled for 2 years. Medicaid was my lifeline, my only real help.
They're designed to be bare minimum.
Virginia uses managed care organizations to coordinate Medicaid for most enrollees. Starting in 2025, new federal rules will require the same company to manage both Medicare and Medicaid plans. The approach is meant to simplify care, but in practice, it often limits choice. When Rachel became dual eligible, they were shocked to learn how benefits could shrink depending on which program you're under.
Well, I just assume that every insurer is going to cover all the medications I'm on, because isn't that how insurance works? That is not how it works. Nobody told me that. Why are there so many things changing? And like, why does this one cover this but not that? This is so strange to me.
Transitioning to Medicare meant getting moved into the aged, blind, and disabled tier of Medicaid. Lower coverage, fewer supports.
But I go from having top tier coverage with Medicaid to lesser coverage with Medicaid because I'm now age blind and disabled. There are certain things that are available on just the general Virginia Medicare side that you can have access to, that you cannot have access to as a disabled person.
Even the paperwork felt punitive. Rachel was told disability forms were written at a third grade level. They disagreed.
I've had the experience of filling out paperwork and having the suspicion of feeling like I'm doing one of those psych profile evaluations that even like if you apply for a job at any just regular sort of chain store, you know what they're doing because they got those things and it's like, and they ask you the same question over and over, but they phrase it a different way. And that is what gives people the impression that like they're trying to catch you in something. Well, they're gonna get you.
Every reapplication triggered anxiety. For someone whose MS symptoms worsen with stress, paperwork became a health risk.
I felt so freaked out and panicked every time I had to fill this paperwork out that I would just leave it sitting there. And then every day would go by and I'm like, I need to do it. I need to do it. It is a full-time job with mandatory overtime, no benefits, just to get through the day. I cannot even explain how much more difficult stress makes my illness. Like, I can literally be do, and if I'm super stressed out, there are any number of things that can happen. I'm already doing a job, and now you've made my job worse. You've made me feel worse. But I have to have you because if I don't, then I'm gonna feel really worse.
Their infusions cost $60,000 every month. Without Medicare, they'd owe 20%. That's $12,000 out of pocket. For Rachel, the trade-offs are constant.
I can't have anything. All the things that I have that are valuable, like in a financial term, someone else bought for me because I can't afford to.
And when they earned $40 on a committee, their food stamps dropped to $18.
It's the being kept at poverty level. And there are consequences for not being medicated with my condition.
Universal design is proof of concept.
Rachel has done community care work for years, but even that comes with fear. They worry any mistake could threaten their coverage.
In, like the last 3 years, I've been doing more sort of like community care work and the things of that nature. And I get really anxious because if I say something and I upset the wrong person, if somebody wants to punish me or hurt me and not have to physically hurt me, like just being reported and being investigated, like that's terrifying. I don't touch it because I don't want it to break. Like I'm terrified losing access to my medication. I don't want to be dramatic, but it feels like a death sentence.
This is the trauma of means testing. The fear of making the wrong move, earning too much, or saying too much, all while public myths about fraud persist, despite less than 1% of disability recipients being found to game the system. And before the reflexive thought of 1% being too much, consider that we're describing disabled Americans accused of not being poor enough for care. As we spoke with Rachel, Virginia's community health centers were facing a crisis. Since January 2025, 16 federally qualified health centers across the state have lost access to federal grants, effectively blocking one of their 3 primary funding sources and forcing some to close dental programs or shut down entirely.
Someone who has no background in health, I'm sorry, gets to come in and say, oh, we gotta get rid of this, we gotta get rid of that. That's more insulting than the people who get to decide whether you're disabled or not, who have no background or medical training.
As a queer, non-binary person living with MS, Rachel knows that anti-trans bills and healthcare discrimination threaten more than dignity. They threaten survival.
When you make people afraid to go to the doctor, the poor health outcomes, just straight up. And this is across board with everybody in the LGBTQ plus community. This is a problem throughout it. There's statistics for it.
And still, they hold space for imagination, for grieving old dreams and making new ones.
Universal design is proof of concept that you don't have to have a world that excludes disabled people or makes things harder for them. And I think I would ask people to think about that. I would ask people to think about what it actually means to be an exceptional human being.
Rachel's story reveals what dual eligibility looks like in Virginia, where the illusion of managed care means less choice. It's a flawed system where federal rules mandate years of waiting, and tragically, where even $40 in earnings can trigger food insecurity.
Making new dreams.
Rachel mastered the system while their body broke down, lived at pain level 5 while strangers debated their worth, learned that surviving isn't enough. You also have to know how not to trigger bureaucratic alarms. In a state where rural hospitals continue to close, the consequences are dire. Communities like Lee County are left with hour-long drives to emergency care, and no new help is coming. Here, recent federal funding cuts have already shuttered health center programs across Virginia. In such a fraught medical environment, Rachel's expertise becomes even more vital and more precarious. Rachel made new dreams because the old ones were made impossible. Rachel's current quest is not simply to have people in power listen, it is to make them believe.
Why do we live in a culture that tells us we are worth less? And that we don't deserve to thrive? I may not be thriving, but I'm gonna try to figure out how to.
In Virginia, where the mathematics of survival are exacting and cruel, Rachel figured out how to make it add up. The question is whether the rest of us will figure out how to build something better. Join us next time as we continue our journey through the South, where the cost of care keeps rising and the true cost of our systems becomes impossible to ignore.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, Visit dualcostofcare.com.